My name is Mr. Phillips. I represent Caston High School. My group name was the ACES Go Clinic, and our proposal was to help homelessness with healthcare accessibility.
Speak Up, Speak Out it grew out of a statewide movement, really, but a civics fair for students to solve problems in their local communities. But for 4 years now, we've been doing it at the local level because we realized our students were identifying problems in San Antonio that they wanted to fix, and then they were going to Austin to present to judges there. And so we thought if we could bring it home and have an intermediary step where they present to people in their own community, they could really engage in a different way to problem solve with adults who really care about helping them.
Speak Up, Speak Out provides them with this window of opportunity where they can really open their eyes to problems that they've already experiencing in their lives, but also think about how they can be involved in trying to solve that issue.
Because many people are unable to access healthcare, and I actually interviewed 2 homeless people, and one of their biggest concerns was not being able to treat diseases that they may have caught.
The teams it's really by choice. The entire project is driven by choice. The students request partners, ideally based on topics that they are, have a shared interest in. If not, then, they work together to kind of overcome obstacles to figure out what project they're going to do or what sort of problem they're going to tackle.
Everyone's voice is heard on the same levels. That's like what makes it, I think, really special.
I volunteer for this event because I think it's so important that we hear these students voice their opinions about what's going on in the world and listen to the way they plan to fix it, right? They're our future. And if they can identify certain things today in 6th, 7th, 8th grade high school that need to be addressed for the future of our city, our state, and our country, it's fantastic.
So something that I learned about myself while working with the team was that being a leader is kind of hard. They chose me as the leader, so it was a little nerve-wracking, but I think that I'm somewhat of an okay leader.
They're passionate about the same issues that we're passionate about. The difference I sense is that they're a little less befuddled on how to fix them than we are as adults. We see the complexity and nuance that kind of stifles change and growth, but the students don't. They want to jump into action, they want to make change, and they want to see it soon.
I think just learning how to project my voice and, present it in a way that makes it easier for other people to listen. It was very fun creating the presentation and talking to everybody here.
They're learning to say, talk to us, ask us how we feel, get our feedback because it might make things better. We're always better off when we talk to the young people about what are you experiencing, how would you make it better? Those solutions can really advance for everyone. Young people about what are you experiencing, how would you make it better? Those solutions can really advance for everyone.
Good morning, everyone. Good morning, CastNet. It's so excited to see you all on homecoming week with your moms. It looks great out here. And good morning, those of you who are joining us by Zoom. participating schools will have the opportunity to identify ways you want to make the community stronger, to collaborate with community experts and subject matter experts, and then present your ideas to people who hold power, who can work with you to implement those ideas to make a change. Many of you will go on to present at Texas A&M San Antonio at our regional civics fair, and then some of you will actually go on to the Texas State Capitol to present across the state there. So I want to acknowledge and thank our partners who are, of course, the Annette Strauss Institute for Civic Life and Dr. Talia Stroud, Dr. Lyssa Ochoa, you're going to hear from in a minute, and the founder of the SAFE Clinic, and then Up Partnership and Texas A&M San Antonio. So, speaking of student voice and agency, I am so excited to turn the mic over to Audrey Torres, a sophomore at CastMed High School, who is going to introduce our first speaker. Thank you, Audrey.
Thank you, Ms. Russell. Please help me welcome Dr. Talia Stroud, Interim Director at UT Annette Strauss Institute for Civic Life, who will explain this year's theme and what it means to the organization.
Hello, my name is Talia Stroud, and I currently serve as the Interim Director of the Annette Strauss Institute for Civic Life. It is such a pleasure to welcome you to the 2022-2023 academic year of Speak Up, Speak Out. The Annette Strauss Institute for Civic Life is an organization at the University of Texas at Austin. Our mission is to educate, inspire, and connect the next generation of civic leaders in Texas. Speak Up, Speak Out is one of our signature programs because it educates students about how to get involved in their communities. And the students, in turn, educate the rest of us about challenges facing their communities. Speak Up, Speak Out hopefully inspires students to get involved. And the students involved in the program inspire everyone involved, from teachers to elected officials, making us optimistic about the next generation's ideas and energy. And finally, Speak Up, Speak Out hopefully connects you to other students and teachers you haven't met. It's an exciting program. For students who have not participated before, you are in for a real treat. This program will challenge you to think about your community and how you can get involved. You'll identify a specific problem in your community, and then you'll conduct research on it. How big of a problem is it? Are other communities also affected? What has your community done to try to address the problem? What have other communities done? What worked and what did not? Equipped with these insights, you'll get a chance to be creative. What's a solution that you think would work in your community? Why do you think it would work? Research shows us that kids and young adults can come up with amazing solutions, and ones that have eluded grown-ups. We cannot wait to hear your ideas. This year is a particularly important one. Over the past several years, we faced many challenges in our society, in our communities, in our schools, in our families, and as individuals. From COVID to a racial reckoning, to political changes, to the economy, to the environment, there is no shortage of important issues. And each of these issues may have profound effects in your community. This year's theme has to do with these types of enduring problems. We want your innovative ideas for addressing them as they affect your community. You probably won't solve the problem. It's rarely so easy, but you can make a difference. And that's exactly what we're hoping you'll do. We look forward to working with you and welcome you to Speak Up, Speak Out. Thank you so much.
Thank you, Dr. Stroud. We are excited to begin producing meaningful projects that will create positive change in our community. My name is Kira Bhakta, and I'm a junior at CastMed High School. I now have the privilege of introducing our keynote speaker, Dr. Lyssa Ochoa, vascular surgeon, founder of SAFE Clinic, and CAST board member who will speak about being active members of our community.
Good morning, and thank you for the introduction, Kira. Good morning. How are you guys doing this morning? Good. Welcome to the 2023 Speak Up, Speak Out launch. So this is a very unique opportunity, as you've already heard, that motivates students to begin giving back to the community at such an early age. The acts of leading, collaborating, and proposing solutions to issues in the community will develop you into an active participant in civic engagement. You know, I have to say, I'm just so honored to be able to be your speaker today and so impressed with what the Cass schools are doing for you, giving you a voice, letting you realize the importance that you have in this community. I'm going to tell you, as a vascular surgeon in San Antonio, I've been practicing here for 11 years. When I first got to San Antonio, I actually worked at different areas in San Antonio, on the north side, downtown, and the south side. And it was in working those different hospital systems in those different areas of town that I began to realize that there were different patient populations, that there were different problems, the severity of illnesses, of diabetes, high blood pressure, high cholesterol, heart disease, varied north to south of San Antonio. I also was able to witness that the outcomes of such diseases were very different on the north to south side. As a vascular surgeon in San Antonio, one of the things that I take care of are people who have bad circulation to their limbs. And that outcome that I follow, that is kind of a marker of the complications of these diseases, are diabetes-related amputations. And when I began to experience that difference personally, because I take care of these patients, I began to do some research in the community. And I did learn that we have very disparate outcomes when it comes to something like diabetic amputations in the near south, west, and east side of town compared to the north. And as a vascular surgeon, my initial question, well, what can I do about it? Do I think that doing more surgery, more operations is going to be a solution to this problem? What do you all think? You see, I'm smarter than I am. I began to learn why we have these disparate health outcomes. I began to learn about the history of segregation and redlining in San Antonio, of the history of lack of investment in infrastructure, whether it was sidewalks, drainage, schools, food deserts, access to healthcare. And when I began to learn that it is the history of this kind of lack of investment and lack of acknowledgement that there are more and more needs, but I began to ask myself, what is my role as a vascular surgeon? Is it just to do more surgery? And so I was someone in the community who would bear witness to the fact that these outcomes were disparate, that diabetic amputations is an outcome that is completely preventable. We can prevent diabetes, type 2 diabetes, we can control diabetes, we can prevent these things. And what that told me is that there were many steps upstream from education, all the way down to by the time they get access to a very specialized surgeon like myself, of where interventions could have been made, right? From education to access to care, to transportation, to health literacy, technology, food deserts, to safe places to live and play. All these things play a role on the outcome that I was seeing. It was then when I sat back and I asked myself, if I am seeing these outcomes, then it is my responsibility to my community to speak up, right? Speak up about this problem and see what we can do about it. As a single doctor in the community, there's only so much that I can do, but actively what I try to do is I try to put my clinics in the zip codes with the highest diabetic amputation rates. We actually have 8 clinics across these areas in San Antonio. But that's just a little part of the big picture, right? I'm only one person. The other part that was so important to me was to begin to collaborate with everybody in our community who cares about this outcome, who cares about this problem. So that's other doctors, that's hospitals, it's insurance companies, that's nonprofits, that's universities, that's medical schools, it's high schools. Being here is a part of my active participation in speaking up and speaking out about a problem that we have in San Antonio. We're not going to solve it alone. It takes an entire community to solve that problem. And so one question I was asked to talk about is about the sustainability of action on the issue. I'm going to tell you what I'm learning is When you find an issue that's a problem, tell people about it. Tell your parents, tell your aunts and uncles, tell your church leaders, tell your teachers. Tell the person you're sitting on at the side in the park, or in the bus stop. Practice your story and why it's so important to you, and learn how it actually affects the people in the community. As you begin to tell your story to more and more people, guess what you're gonna do? You're gonna learn from these people. You're gonna learn from people who hear about this issue that has something to contribute to that problem and to the solution, possibly. And so as you begin to tell this story of the issue that you see in your community, you gain momentum by recruiting people in your community to speak up about the same issue. And I think that's how we sustain an issue and tackling that problem, which is why I'm here, partially, right? I'm here because I hope to maybe inspire some of you to understand the issue that I'm trying to tackle and figure out how we provide a solution to that. I do believe that we can't think about solving solutions, and like you heard before, we're probably not gonna solve these big problems. Because as I told you, diabetes-related amputations have multiple contributing factors. But the reality is, if we start in our community, we start local, start with your friends and your family, take it out to your teachers, your church leaders, your city leaders, your council members, our county leaders. Now, I'll be honest, when I was in your grade, I had no idea who those people were. But I know that these leaders in our community support what you guys are doing. They support what you all are representing to us. What I want you guys to know is that you are powerful. Your voice counts and your voice matters. If I'm probably not going to maybe make a big difference in my issue that I'm fighting for, I can tell you that you all, our youth, have the power, have the voice to speak up and make a difference and better our future. I'm not sure if you realize that that's the power you have right now, but I'm going to tell you, start looking around in your community, start identifying those issues that are important to you that only you can figure out. Because it's your own lived experience in your community where you find these issues. And start talking about them. Start trying to figure out solutions to them. For all you know, it might take no time before you guys get to change our world and make our future so much better. And that's what I look forward to. Thank you.
Dr. Ochoa, thank you for sharing your words of wisdom and encouragement with all of us. Your power and advocacy for our community is powerful. Last year, we had an amazing experience at SUSO and even won first place at the 2021-2022 Regional Finals. Hello, everyone. My name is Samara Vega, and I am a senior at Casman High School.
Hello, my name is Aiden Elizondo, and I'm also a senior here at Casman High School. If you have any questions we would like to ask those of you in the Zoom, so please ask your questions in the Zoom chat. And for those of you in the audience, you can ask them over here at the microphone. Thank you.
How many students can make one team?
Based on this experience, I'm not that students participate in active person as well.
What are the topics students can, what kind of topics students can choose from?
Well, the topics vary from the challenges the students think are most important, which would be like healthcare, environmental issues, well-being, civic engagements, community safety, neighborhoods, and educations, and that's only to name a few.
What was your experience like at the Suso region competition?
I would say our experience was nothing like we had ever experienced before, because you're not only presenting to new people, but you're presenting to people who can help you make a difference in the community. So we had a project on like community engagement within the environment and how to make mental health better within the environment by taking care of it. And we presented to, I believe, four people that actually try to help us make the difference. And through there, we were able to make it to state and talk to people who can make even a bigger impact.
Well, thank you all so much for joining us today. At Texas A&M University, San Antonio, and we are grateful that Mayor Ron Nirenberg also accepted our invitation to give the kickoff official launch for the regional finals, and that is taking place on January 9th. And then we also are looking forward to the state finals, which will take place at the Texas State Capitol sometime in March, so the date is still yet to be determined, but that will also be announced and spread out to the teachers and students who are participating. So one last thank you to all of you who joined us today, to our keynote speaker, Dr. Lyssa Ochoa, Dr. Talia Stroud with the UT Annette Strauss Institute for Civic Life for their partnership, in addition to Texas A&M University San Antonio, Up Partnership, T. Donovan Creative, and Frost Bank. So thank you all so much for joining us on Zoom. This video will be posted on our website and will be sent to you shortly after. Thank you.